Παίρνοντας παραδείγματα από άλλες χώρες που κινούνται πλέον με την ίδια ταχύτητα με εμάς, θα ήθελα να παρουσιάσω, μάλλον να δώσω τον λόγο να παρουσιάσει ο καθένας τον εαυτό του. Ας ξεκινήσω με την Jinane από το Βέλγιο, να σας πει 2 λόγια και για το έργο της και για το hub στο οποίο υπηρετεί.
So, good afternoon. Thank you, Sofia. So, my name is Jinane Ghattas, and I work for the Implementation, Monitoring, and Evaluation Unit of the Cancer Center of Cienzano, the Belgian Health Institute. I'm a scientist there, and I'm the project manager of the Belgian Europe's Beating Cancer Plan Mirror Group, which stands for the National Cancer Mission Hub-like structure that we have in Belgium. And I'm happy to walk you through today our experience in Belgium and exchange about that. Can I just... Maybe. Perfect, thank you. So, as Hugo said, and as everyone in this room know, there was the Mission on Cancer and the EBCP that were launched in February 2021. So there were lots of fundings coming from the European Commission, lots of projects, so we needed to organize ourselves, not just financially, but also in terms of human resources, and in terms of priorities in Belgium. So we needed to make sure that the right funding is going in the right place to match the Belgian needs. And this is where the cabinet of Minister Van der Broeke mandated the Cancer Center of Cienzano to support the implementation of the Belgian EBCP, of the EBCP and the Mission on Cancer in Belgium. And that's how the Belgian EBCP Mirror Group started. So within Cienzano, within the Cancer Center of Cienzano, we took up the secretariat of the Belgian EBCP Mirror Group. And the Belgian EBCP Mirror Group is a national stakeholder platform in which we gather all the stakeholders that work on cancer in Belgium, of course, as much as we can. So far, we have over 400 members, and we cover the whole disease continuum. So as you can see here, the Mirror Group is divided into different thematic working groups. So there are thematic working groups that cover prevention, early detection, screening. We have diagnosis, treatment, quality of life, care organization, survivorship, citizen and patient engagement, children, adolescent, and young adult, as well as data innovation and AI. So stakeholders have the choice to just go and choose the thematic working group they are interested in. Each thematic working group that we have is also led by experts from the Cancer Center of Cienzano to ensure that we have the appropriate expertise to lead the thematic working groups. And the involvement of these leads, I would say, it's on a pro bono basis. So they do it usually on top of their job. And this is important to mention because it's important also to the sustainability of the National Cancer Mission Hub in the future. In terms of activities, we started with 3 types of activities. The first one would be disseminating about the Mission on Cancer and the Europe's Beating Cancer Plan to raise awareness, because maybe for us, we might be more involved in European projects, but of course, when we talk about national context, we all have our projects going on a national level, and we might not be as involved on a European level, so it's important that the Mirror Group brought the EU initiatives and raised awareness about these initiatives. Then the second type of activities that we do is matching the Belgian needs with the appropriate EU funding. We do that, for example, through a policy brief series. So we developed, in consultation with the stakeholders of the Belgian EBCP Mirror Group, a series of policy briefs covering different areas of cancer, such as prevention, diagnosis, etc. And they were published in a peer-reviewed journal, but also submitted to the cabinet of Minister Van der Broeke, and in that way would be also contributing to policy and guiding that. And the last type of activity that we do is monitoring Belgian participation in cancer-related initiatives, whether it's on a European level or on a Belgian level, which is also, you're doing well in Greece. We already had a chat about that. So I would say that our objective is to go from vision to action. We started by, oops, how can I go back? Voilà, yeah. So we start by identifying appropriate or relevant European calls that could be relevant and pertinent for the Belgian needs and the Belgian stakeholders. We support with consortium building. This depends if Cienzano is involved in the call, then we would go till the end and we submit the proposal as well. If not, we bring stakeholders together and it's up to them to build the consortium. There's, of course, the submission of the proposal and the implementation in Belgium. And this is, of course, an important part because we started by monitoring the European calls and sharing them with the Belgian stakeholders. But our job doesn't stop there. We should ensure that there is proper implementation that is happening in Belgium. And that would be the important point to take up after also the EBCP and the Mission of Cancer, because of course we are participating in EU projects, but it doesn't have to end there. We need to ensure sustainability and proper implementation in Belgium. So to do that, we're also, we put in place a process for feedback on implementation in which we go to the field. So we go and speak to hospitals, to healthcare professionals, and what we call in Belgium now the potential CCCs, comprehensive cancer centers. We speak to them about their participation in EU projects, about how do they manage, about how is it possible to implement these outputs in Belgium. And that would be what we call a feedback on implementation that ultimately will lead us to future perspective, and that's a new exercise that will be done actually in consultation with stakeholders, which will be a future-looking exercise, a foresight exercise. So this is just an overview about our monitoring activity. So far, between 2021-2023, Belgium has been part of 17 EU4Health projects. Horizon Europe, we were part of 66 projects. And this excludes European and international organizations based in Belgium. So we took as a scope the Belgian focused organization. I added here the website if you want to have more information about our National Cancer Mission Hub, where there's, of course, more details there about our activities. And with that, I think I will hand over to Sofia.